The vital importance of proper oral care for seniors. Insights from Dr. Michael Stone. Welcome, everyone, to this conversation about senior health and well-being. I am Dr. Michael Stone, and I've spent over 40 years working in a dental clinic, caring for countless elderly patients. Today, I want to ask you a simple question. How many of you brush your teeth 3 times a day? Once in the morning, once after lunch, and once before bed. I'm sure many of you will nod and say, "Of course, doctor. We've been taught to brush our teeth 3 times a day since childhood for healthy gums and fresh breath." But what if I told you that this routine, the one we've trusted for a lifetime, may actually be silently harming your health and even shortening your lifespan? Some of you might be surprised, even skeptical. You may say, "That can't be right, doctor. You're exaggerating." But please, allow me just a few moments to explain, and I promise you'll see what I mean. What I'm about to share isn't just a theory or rumor. It's based on over 4 decades of firsthand experience. Throughout my career, I've witnessed and examined thousands of elderly patients. It's not about brushing your teeth more often. It's about brushing them the right way. If you brush your teeth incorrectly, you can inadvertently damage your teeth and gums, causing more harm than good. So, why might brushing 3 times a day be harmful for individuals over 65? And how can you protect both your teeth and overall health? If you'll bear with me, I believe that just a few small changes can help you maintain healthy teeth, enjoy meals, smile with confidence, and live happily with your family for many years to come. Mistake number 1: brushing too much and too hard. Let's start with a common issue many of us face: brushing too hard and too frequently. Have you ever looked in the mirror and felt like your teeth are getting longer? In fact, your teeth aren't growing. What's happening is that your gums are receding and the roots of your teeth are becoming exposed. This phenomenon is called gum recession. Shockingly, 8 out of 10 older adults experience gum recession without even realizing it. Last year, I had a patient named Mr. Robert Davis, who is 86 years old. He came to my clinic complaining of sharp pain when eating, and even a gust of cold air would send a jolt of pain through his teeth. Mr. Davis told me, "I brush my teeth 3 times a day, doctor, and each time I make sure to brush for at least 5 minutes. My wife jokes that I spend more time in the bathroom than in the living room, but when I examined his mouth, I discovered severe gum recession, exposing the sensitive roots of his teeth, which were becoming loose. Why did this happen? Because brushing too often and with too much force can harm the gums, especially as we age. Imagine your gums like skin. When we're young, they're thick and resilient. But as we get older, they become thinner and more fragile. Brushing too aggressively with a hard brush is like rubbing a delicate leaf. It can tear and wear away the tissue. Mr. Davis is not alone. Many seniors I see in my practice express frustration, asking, "Doctor, why are my teeth so weak despite taking such good care of them?" The answer is simple. Brushing too hard and too often can actually harm your gums and teeth. Scientific studies have shown that older adults who brush with excessive force are twice as likely to experience faster gum recession compared to those who brush gently. So, here's my advice for you. Use a soft bristled toothbrush. A brush with ultra-soft bristles will clean your teeth effectively without damaging your gums. Brush gently, not aggressively. Hold your toothbrush at a 45-degree angle to your gums, and use small circular motions. Imagine you're cleaning a delicate egg. Gently and with care. Brush only twice a day. Brushing after breakfast and before bed is enough. Limit each brushing session to about 2 minutes, and avoid overbrushing. If you adopt these changes, you'll likely notice improvements within just 6 months. Less gum recession, stronger teeth, and better overall oral health. Mistake number 2, choosing the wrong toothpaste. The second mistake I want to highlight is choosing the wrong type of toothpaste. Many seniors are drawn to toothpaste that promises whitening or plaque removal, thinking, these will make their teeth healthier. But the reality is, especially after 60 or 70, using toothpaste with strong abrasives can actually harm your teeth. Take the case of Mrs. Susan Thompson, a 79-year-old patient who came to me complaining of extreme tooth sensitivity. "Doctor," she said, "every time I drink something cold, it feels like I'm being stabbed in the teeth." Upon examining her, I found that the enamel on her teeth had been worn down almost completely. The reason? She had been using a whitening toothpaste for years, thinking it would give her that bright smile. Whitening toothpaste often contains abrasive ingredients designed to scrub away stains, but these can wear down the enamel, which is already thinner in older adults. Think of it like an old pair of shoes. If you keep scrubbing them with sandpaper, they'll wear out faster. Research from a medical university has shown that seniors who use toothpaste with high abrasiveness for just 2 years increase their risk of tooth sensitivity and gum inflammation threefold. So, what kind of toothpaste should you use? Look for low abrasion toothpaste. Choose a paste that's gentle on enamel and doesn't strip away protective layers. Choose fluoride toothpaste with around 1000 ppm fluoride. Fluoride helps strengthen teeth, prevent decay, and reduce sensitivity. Opt for toothpaste made for sensitive teeth. These pastes are formulated to protect sensitive areas and soothe discomfort. After switching to a gentler toothpaste, Mrs. Thompson returned to my clinic just a month later, smiling brightly. "Doctor, I can drink cold water without that sharp pain now, and my food tastes so much better." Mistake number 3, brushing immediately after meals. Another common mistake is brushing right after meals, especially after eating acidic foods like citrus or drinking carbonated beverages. Many of us were taught that brushing after eating is essential to prevent cavities, but this is not always true, particularly for seniors. Let me tell you about Mr. Thomas Lee, a 77-year-old retired military man who was very disciplined. He told, proudly, "When I was in the Army, we had to brush our teeth within 3 minutes after every meal. I've kept that habit even at home." However, when he came to see me, I noticed that his teeth were worn down, and he was experiencing pain even when drinking warm liquids. The problem is that acidic foods and drinks, such as oranges, pineapple, or soda, temporarily soften the enamel. Brushing immediately after eating can further erode the enamel, which is like rubbing a damp wall with a rough brush. The more you scrub, the more damage you cause. A study from a medical university showed that seniors who brush right after meals are 2.5 times more likely to experience enamel erosion than those who wait 30 minutes. So, here's what you should do. Wait at least 30 minutes after eating before brushing. This gives your enamel time to harden again. Rinse your mouth with water or a mild mouthwash after meals to remove food particles and reduce acidity. Use sugar-free gum or mouthwash to freshen your breath in the meantime. Mr. Lee followed these tips and a few months later told me, "Doctor, I can finally enjoy my morning coffee without that painful sensitivity." Dealing with dry mouth in older adults. Lastly, let's talk about dry mouth, which is a common issue for many older adults. As we age, our bodies produce less saliva, and medications often exacerbate this problem. Dry mouth can cause discomfort, difficulty eating, and increased risk of tooth decay and gum disease. I remember Mr. Frank Adams, 85, who came to my clinic complaining about dry mouth. "Doctor, no matter how much I drink, I always feel thirsty. My food tastes bland and I can't enjoy my meals anymore." Upon further investigation, I discovered that Mr. Adams was taking medication for high blood pressure and diabetes, both of which can reduce saliva production. Saliva does much more than just keep your mouth moist. It helps wash away food particles, protect against cavities, and support digestion. After age 65, our saliva production decreases by 20–30%, and this can be worsened by medications and dry environments. Dry mouth can lead to a host of serious health problems, from cavities and gum disease to difficulty eating and even a lack of appetite. To combat dry mouth, here are some simple tips. Drink water regularly throughout the day. Take small sips frequently rather than waiting until you feel thirsty. Chew sugar-free gum or suck on sugar-free lozenges. This helps stimulate saliva production. Use artificial saliva if needed. These products are available at pharmacies and can be very effective. Avoid alcohol-based mouthwashes. Alcohol can further dry out your mouth, so look for alcohol-free options. Talk to your doctor about your medications. If your meds are causing dry mouth, ask if there are alternatives with fewer side effects. Mr. Adams, after following these tips, returned to my clinic a few months later and said, "Doctor, my mouth doesn't feel dry anymore, and I can taste my food again." Final thoughts: taking care of your teeth and gums is not just about having a beautiful smile or fresh breath. It's about maintaining your overall health and well-being. With a few simple changes in your daily routine, you can protect your teeth and gums, improve your quality of life, and ensure you enjoy many more years with your loved ones. Thank you for listening, and remember, small changes today can lead to a healthier and happier tomorrow.